The most sensitive organ in your body, the control center of thought and feeling, is untouched by pain. The human brain itself cannot feel pain. Unlike the skin, muscles, or blood vessels, the brain's tissue contains no pain receptors. This unique quality sets the brain apart from every other organ. For surgeons, it means the brain can be operated on while patients are awake, conscious, and able to respond. Pain begins elsewhere in the body's network. Specialized nerve endings, nociceptors, detect injury and send signals through intricate neural pathways, racing up the spinal cord to the brain. The brain interprets these impulses as pain, allowing us to react and protect ourselves. Yet it cannot generate pain from its own tissue. In the operating room, something remarkable unfolds. During awake brain surgery, patients remain conscious, talking, moving, and answering questions while surgeons carefully expose and work on the brain. Doctors map essential regions responsible for speech, movement, and memory, watching as patients perform tasks. This real-time feedback helps protect vital functions, ensuring tumors or epilepsy can be treated without harming what makes us unique. As the patient speaks or moves, their brain regions light up, guiding surgeons to preserve health and ability. The brain feels everything except pain itself.